So let's continue with another topic. Is challenges in vector control strategies. So there are many challenges as far as vector control is concerned. So I will talk about the global aspect and then come to the Indian scenario, and then specifically what we have faced here. So I maybe you will be having similar experience also, which you can share. Okay, so we have different, the vector species. You could see the vector species, and then the parasite or the viral infections, the diseases transmitted. These are the global, infectious diseases, especially vector-borne diseases transmitted by different vectors. So let's concentrate on the mosquito-borne, especially the vectors which are and vector-borne diseases are prevalent in our country. So we have Anopheles species. There are six primary vectors transmitting four different Plasmodium species, and transmitting with the help of four different Plasmodium species transmitting malaria. I'm sorry, and then also the QLX vectors transmitting lymphatic filariasis. That is, the parasite is Wuchereria bancrofti. And then in some places, like especially in Kerala and some other places, you find another parasite called vectors Mansonia species transmitting Burgea malaria, Malayan infections. And coming to the other dengue vectors, you have Aedes aegypti and albopictus, which are incriminated. Chikungunya last 14, 15 years, onwards, many work has been done on chikungunya, especially in Indian subcontinent. So then, of course, you have now Zika virus in place now. And then coming to Japanese encephalitis, so the Vishnu group, Tritoneurogus group, playing a major role in transmission of these infections. And then to a certain extent, we have also visceral and cutaneous leishmaniasis and Chandipura viral encephalitis. And then also coming down, we have the tick-borne infections uh, uh, transmitting tick-borne infections in many places, and also uh, we would have heard about the Nipah viral infections and through transmitted to viral infection transmitted through bats. So these are the major global scenario if you see. And then next, so as far as the vector WHO vector control from 2017 to 22, which they have published in 20, they have given the priority activities as far as vector control strategies are concerned. So and this is to align the global vector control response. Major aspects are needs assessment conducted based on the resource mobilization. So develop especially for outbreak investigations and outbreak response. And insufficient resource mobilization is one aspect which the priority goes. And then, as you see, the second aspect is the entomological background, entomological support. So, which is lacking, and we know that in many places now, which we said that it is going to be entomology is going to be endangered species. Now, it is some places it is almost extinct. So we really don't have much force because people get retired, and then most of these techniques are being used, and molecular biological techniques are being used. So the phenotypic ones, the conventional methodology of identifying mosquitoes, seeing the characters, people are not much. Students are also not interested. They all want to move into molecular biology. So that is one thing which has to be priority has been given worldwide. And then also the relevant staff. And if you see the third point also, it is related to entomology. So these are trained public health people for entomology. And I believe that this particular training is to it's a reorientation program to train the public health and then understand. Also, it has to be followed up with the field-based training to understand, because this is theory itself is not sufficient for people to understand more on the entomological aspects. And as we see that we also need to have a network support training, because some of these research aspects are being done by the research institutes, but then program-based work is being done by the state public health help or the national public health. But then the research done by the research institute as well as the program should be interlinked, should hold hand in hand. So then only work hand in hand, then only this effective output would be there. So the national and agendas for worldwide would be basic and applied research in entomology and vector control, and the progress has to be reviewed and see that entomological surveillance, in addition to the parasite surveillance, entomological surveillance has to be given impetus, and that has been given by the World WHO last few years back, and then multi-sectoral engagement vector control, that is also needed, because as we all know that it is disease oriented. Like we have malaria workers, we have other vector control workers. Earlier it was specifically for malaria. Now we all know that these two vectors, that is malaria and the dengue vectors, breed in almost the same habitat, like a container habitats, and you find cohabitation of these two vectors. So a plan should be a cohesive plan, so that if you target on these vectors, so we will have a, if it is meant for malaria, it is not a collateral impact on controlling the dengue vectors also, but then it should serve in such a way that both the disease have to be taken into consideration, and then so we have an comprehensive vector surveillance plan. And nowadays you all know about the integrated vector management methods also. So then the vector surveillance also has to be routine. So it is not that whenever there is an outbreak investigation, people do surveillance and then forget about it. So this has to be routine, to see that in some areas where the vectors are new vectors are coming and breeding, or vectors the abundance are there. I mean, so that sort of study, it has to be there as a routine practice, even at the grassroots level. So district, I mean, when you take the state, it's not at the district level, it should be at the at the village level also, to see that if there are some cases coming up in a specific areas, in specific locations, so that can be targeted, and then to avoid spreading of the infections. And these national targets are also for protection at risk population with appropriate vector control. This appropriate vector control is something which is situation. We say that evidence and situation based vector control measures specific for that location. So, and any vector control intervention that cannot be used everywhere, it can be used in addition to other specific methods. That's what we did. That is known as integrated vector management program. So you will have some specific measures, like in, for example, in urban areas, you may find breeding habitats as more over tanks and other water storage containers. So we have methods to target these sources, so you can have a permanent solution to it. So it's by habitat modification or having a proper plan, so that the manpower need not be used routinely, because we lack manpower in many urban areas because of the expansion of the areas, and then more and more additional vector breeding habitats are added onto it. This becomes an issue, especially in many urban areas. Next. So coming to the global vector scenario concern, so you have the major four pillars on to a two primary foundation. One is to enhance the vector control capacity. So vector control capacity is to be enhanced to target all these vector-borne diseases, and increase in the basic and applied research. The basic research is needed, though we all move to the applied research. Basic research is needed, and innovation has to be needed. For example, now we have the as larval source management, as the conventional larvicide is only Tamifos. We don't have any other source to be used in potable waters, though IGR and all are coming up. So as of now, it is Tamifos. So you need to have other intervention method, strategy, plan based, or whatever it is, to target. So these innovation methods is continuous process, and it has to be it is as WHO has envisaged, that it has to be on four different pillars. One is to strengthen the inter and intersectoral coordination. That is important. We had a few decades back we had is intrasectoral coordination with different agencies, because all these agencies unknowingly contribute to mosquito conditions. So unless you tell them that these habitats are breeding habitats, so that is something which is even needed. Community has to be mobilized, because it's not possible for only one agency to tackle it. As far as dengue is concerned, you know that community mobilization is an important aspect as far as vector control is concerned. So that is another vector. And then as I was talking about vector surveillance, and this has to be an enhanced and then methodological vector surveillance mechanism, so that this can be monitored on a routine basis, and the evaluation of any intervention, whether it's LLIN, the usage, the coverage, whether people are using it, whether they are all of them in the family are using it or not. So this is something which is needs the vector surveillance will help us to evaluate the intervention strategies. And we also need to scale up and integrate tools and appropriate methods to be scale. I mean, we need to scale up these methods to target. As we all know that the vector control tools now in practice, especially for malaria, is LLIN and IRS. And then in some areas, larval source management is also there, and that has brought down the vectors drastically down, and also the disease. So LLIN has played a major role, and distribution, government has distributed many nets in rural as well as in some urban areas also. So that would take care if people are resting or sleeping under bed nets, that would prevent the mosquito contact. That will the mosquitoes, the vectors which are incoming in contact with these nets, LLIN, that will be killed. So that plays a major role in the disease transmission is concerned. And this is a picture of sub-Saharan Africa, and I mean, how many cases have been averted or deaths averted. So you could see the dark blue line attributes to ITN, and then you will find a small above that light blue color shaded IRS. So if you see that. If you see that major chunk is IRS and ITN and IRS, which plays targeting vectors, which played a major role in reducing the cases and reducing the morbidity and mortality. So even we have history indicating that vector control has brought down many vector-borne diseases. So this picture shows that, I mean, with the proper implementation of the LLIN or IRS can bring down infections over a period of time. And this is a global distribution of 7 to 8, almost 8 vector-borne diseases. You find it is mainly in the tropical and subtropical areas, and some some areas also you find in the near adjacent to the temperate regions. But then those areas, the disease has been eliminated, especially recently China has eliminated malaria. So you will find mainly in the tropical and subtropical area, especially you see the India, Southeast Asian countries, and on top of it, on top of Australia, you find Papua New Guinea and other countries. Coming to Africa, you find this sub-Saharan Africa, mainly contributing all these vector boundaries, and then the Mexico and South American, Latin American countries. So this shows the global distribution. The dark blue shows the amount 9 vector-borne disease, and then the lighter shade ones depending on the less number of vector-borne diseases, and you find. But then you find more of these the tropical areas. Next, and this shows the burden, the reported burden in comparative of India and Odisha. I've cited Odisha also. Over a period of time, now the cases have come down drastically, and these are, I reiterate once again that these are the reported cases. So as far as malaria is concerned, so I mean, cases per annum, and then 77 deaths have been reported. And then in Odisha, you find so many cases, 39,000, that is 2019 data. And filariasis now it is reported based on the endemic districts. So, and It's not the case as such because MDA is going on, and then in Odisha, 20 districts are there. Dengue, you find a lot of cases coming up, and then you find more cases in many other places. But then deaths are also more as far as other vector-borne disease is concerned. You find that now dengue deaths are more than the malarial deaths, and chikungunya, of course, it leads to morbidity only, not mortality has not been associated. And also, Kala Asar has been reported basically in West Bengal, and then you don't find in Odisha. Japanese encephalitis, of course, it is there, and this is from the source and VDBCB. And coming to malaria, you find this high risk towns and cities, and it is based on certain aspect that is. You see the western and the northern side, it is basically on the industrial belt, agro industry based belts, which are playing a role in the transmission of urban malaria. And then coming south, you find the industrial and the water scarcity areas, especially if you see places like Chennai, water storage practices more. So therefore, in urban malaria is based on the water storage areas. But you also find areas in the mining belts, West Bengal, and also in Agartala cases. Northeast, you find only in Agartala, but then the eastern, northeastern, eastern part, you find basically in Odisha and Calcutta and other places, Jharkhand. So this, I want to show you a challenge as far as the breeding habitats are concerned. So you find it difficult, to treat habitats. So you cannot, so you see, on the top extreme left and the middle one, these are all, water storage tanks. The left hand one is an overhead tank. So some places you find step stones to climb and then see these habitats. But in some places, you don't find any stepstones or ladder, so that makes very difficult for the intervention person or the program person to treat these habitats. So in fact, it's really difficult. Maybe only a Spider-Man only can treat those sources. Otherwise it's difficult. Now drone-based mechanisms are coming up, but then the effective way of using this drone-based for larviciding is still a question. Whether they would be able to treat these habitats properly as human beings do, and how they will maneuver. You need to have a proper camera to operate it. So these are things which are, bothering us a lot. But then these habitats, if they are kept open, they are going to create mosquito breeding conditions and vector breeding. And you also have breeding sources like wells and all. Many wells have been turned to tube wells now, which is very good. But then, of course, those wells which are open still contribute to vector breeding. And then you find on the down lower extreme left is an underground tank or a sump where they store water. There also you find, because it's if the lid is not proper, you find breeding of Anopheles stevensii and also Aedes aegypti. And cisterns, you basically find cisterns and drums. You find basically breeding of Aedes aegypti mosquitoes and also Anopheles stevensii. So in some habitats, you find all these vectors like Anopheles stevensii, Aedes aegypti, and Culex conjugatus breedings together. So that means so these vectors also are found together depending on the habitat and also the water quality pattern. So you find all these vectors breeding. There are certain habitats. These are all ornamental habitats. We call them as ornamental overhead tanks. These are nothing but overhead tanks model. Each person has its own view. It's fine to have their own vision, to have different shaped over tanks, but at the same time, care has to be taken that it is completely covered. It could be a car or whatever it is, van or boat, ship or cup and saucer, but then this has to be properly covered. That's a major issue. You spend a lot of money. We find that many people spend a lot of money on these different shaped structures. These are found mostly in some areas, especially in northeast. In northern part of Chennai, where we have taken this picture, and then not much effort has been taken to cover these over time. So that creates a problem, and you don't find any ladder or stepstone. Treating these habitats will become a definite issue as far as malaria is concerned. So vectors are concerned, and then especially and this is a hardcore area as far as malaria is concerned. You also find, see, I mean, you can find different structures. I mean, I was citing some examples, and down you find some of these habitats with stagnation. You could clearly see from a adjacent building, otherwise you are not able to see. And even in habitats where they have cemeteries also, they constructed some structures where water will not be flowing, and then you find even the outlet would be blocked, and then you find water stagnation leading to it. So, in addition to these structures, there are so many other structures in and around in peri-domestic areas, whether it could be a cemented tank, a plastic barrel, or plastic buckets, or any tanks, plastic bottles. All of these will contribute to the vector. Aedes vectors are concerned. Aedes aegypti, dengue vectors are concerned. So this plays a major role in the breeding of Aedes aegypti and albopictus. Water storage and water scarcity is more related to Aedes aegypti, but then in some peri-domestic areas where vegetation is there, you find sylvatic form Aedes albopictus also there. And then there are some discarded habitats where, even after immediate rains, also you find water